I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. Today I'm going to talk about how I think about the inflatable penile implant surgery or penile implant surgery in general. We explain penile implant, especially inflatable penile implant, to the patients. We always tell them they will have a shorter length of the penis after the surgery. In general, that's how I was trained, and probably that's how we usually explain it to them. But I always had a question, why does it have to be that way? When we think about the goal of the erectile dysfunction treatment is patient satisfaction. But when it comes to genital areas surgery, I think we are missing some important point. Let's say when the woman gets a radical mastectomy, take their breast, cut out because of the breast cancer. Then the plastic surgeons can reconstruct the breast. But what if the plastic surgeon tells a woman, because you didn't have enough tissues, we had to make your breast smaller than before. Or let's say, because you had too abundance of the fat tissue, we made it even bigger. Then the patient who got the surgery obviously won't be happy, because she wanted the same thing what she had before. Obviously, breast reconstruction surgery is not really to gain the function, right? That breast won't be able to, nurture the baby, or it has the full sensation. No, that breast is just for the shape. So there's some difference between the penis and the breast, but still, the thing I wanted to point out is that genital surgery, we have to think about is the shape and it's the size as well, because that really matters to the patient and their perception toward their genitalia. Personally, I think the same concept should be applied to the penile implant surgery as well. That's why I think size matters when it comes to surgery. The way I see this surgery is that the primary goal is, of course, restoring the erectile function. But from the very beginning, we surgeons should really focus on how to maximize the patient's penile size after the surgery as well. If that's not the goal of the surgery, throughout the surgical evolving of the surgical technique, we can't really implement necessary steps or think about the new techniques that can help that out. I think that we should not discourage a patient from having what they want to have, what they wanted to have, which is the similar of size of the penis like what they had before. I'm not talking about enlarging the penis or make it bigger or something like that, no. But we all know that erectile dysfunction will make the patient's penile anatomy smaller, narrower, and shorter than before. If that's the case, if there's a way, we should really think about how to restore the size. They lost their size and they want to get it restored. I don't think that's outstretched desire to get it back. That's why I implement some of my own techniques, how to make it better. That is something we have to think about in the coming days to make our patients have a better results. This is, I believe, why we doctors need to understand the concept of the quality of life medicine. Conventional medicines, we doctors make the diagnosis and give the patient what they need to get done. But when it comes to quality of life medicine, which is a medicine field when we aim for the patient satisfaction by restoring their function. In that case, we have to aim for the patient satisfaction. So we really don't dictate what the patient wants. We serve what patient desires. Without applying this concept, I believe will help penile implant surgery results much better, which is a patient satisfaction.